whether we are religious or not, whether we believe in divinity or we are atheists, we are all on a spiritual journey. Probably some of us don't know it yet. Just wait for a serious health related suffering to come, and we will realize the pain of existence. And that is where spiritual strength will take us forward. And for this, our eminent speaker, Dr. Rajeswari Sunku, is going to enlighten us on integrating spirituality in elder care. Ma'am, the stage is yours.
Good afternoon, everyone. At the outset, I would like to thank Dr. Sajesh and his team for giving me this opportunity. In this hall, there are stalwart geriatric physicians and eminent speakers, senior colleagues, and my dear friends and respected chairpersons. Good afternoon to everyone. I would like to speak on integrating spirituality in elder care. Taking care of the people is the greatest honor we could have. Why we need spirituality in healthcare? It's bringing human values in healthcare. It will make us to enjoy our profession and we can cope better with our work, and it improves our moral and prevents burnout and staff retention, and sickness absence also will be reduced. What are the values? The values are innate qualities of the soul. These are all values. What are mentioned there, like hard work, simplicity, punctuality, discipline, positivity, dedication, respecting others, love, honesty, compassion, kindness. We all have all these values with us. Bringing these values, which will help in our practice, and we can rediscover our own personal values. In this picture, the person who is lying down was a famous Sanskrit scholar. He had leprosy. His family members disowned him. All the way he walked to Sevagram, and there also Bapuji inmates who were there in the ashram also were not allowed him inside the ashram. So Bapuji treated him by keeping him in the premises of the ashram. He cleaned the wounds, the leprosy wounds, and dressed. After some time, he became fine. So then later in 1939, the stamp was released stating leprosy is curable. Being a non-medical person, Bapuji could do, that is with compassion, empathy. We have many times we see even in a newspaper also, it was the statement given by our late past president Pranab Mukherjee, provide healthcare with human touch. The current challenges in healthcare, poor non-verbal skills, eye contact, active listening, a smile to soothe nerves, punctuality, and positive response. I think everyone must be knowing all these things which we are facing at present. We see even in the newspaper many times the resident doctors are stressed out and attempting or the committing suicide. What are these values? Or these are taught or the caught? During our MBBS or the postgraduate curriculum, we are all busy with studies, formal lectures, tutorials, and practical training and apprentice learningship. But our traditional training lacks guidance for enhancing qualities like calmness and compassion. In our geriatric group, we need lot of compassion, love, care, empathy. We need to explain in their language, and it requires more time to see the geriatric patient. They are neglected by the society, at times even by the family members. By the time they come to us, They have financial constraint also. This is sometimes it is our responsibility to guide them regarding alternative therapies or what is possible for them. What are the qualities of a spiritual person? Acceptance, kindness, patience, tolerance, and generosity. What is spirituality? Spirituality is the act of using our inner resources of peace, positivity, love, compassion for the benefit and healing of ourselves, not only ourselves and also others. Spiritual life is not changing our wardrobe or the diet or the lifestyle, it is about shifting our outlook. Rather than thinking about the profit, what we can offer to the people, rather than grabbing what we can give, rather than thinking about ourselves and me to you, expanding mind to accommodate higher pursuits. Spirituality is looking inwards whom we are or who am I. What are our values? What gives meaning and purpose to our lives? It's about our true identity, peace, compassion, love, and happiness. During our journey, we accumulate anger, stress, fear, worry, and ego. Otherwise, the peace, love, happiness, and contentment are the original qualities of the soul. The way to spirituality, it is meditation. It is an effective way to experience a sense of peace and well being, discovery of silence within. It helps us to disconnect from damaging habits of thought, feeling, and reaction. Meditation is a technique of mental evolution. It involves practice of concentration of mind on a point of physical or abstract. It's impassionate observation of mental activities. Remaining calm and silent for a period of time, we purify mind through positive thinking, speaking, and doing. And it's an observation of our own breathing. It's a pathless path. There is no technique for the meditation, technique. There are no laws. Be who you are. God is your father and friend. Sit and talk to him. No rules to talk to our father or the true friend. Meditation is the celebration. It's an ultimate divine experience, divine dance, joy, and bliss. To bring these values in healthcare, there is a personal and team developmental program for healthcare professionals. It has been introduced by the Janki Foundation for Spirituality in Healthcare from London. The program is called as Vihasa, Values in Healthcare, a Spiritual Approach. She is late Dadi Janki. She was former administrative head of Brahma Kumaris. There are so many people from left to right, Dr. Sara to last Miss John Alcoy. They're all nearly 11 members team. They have done intense work for the 4 years before these total Vihasa pack come into the picture. It was in the year of 2005. It was launched in India, and in April 2006 by the late Dr. APJ Abdul Kalam. The doctor who is there, the pointer, okay. He's Dr. Ashok Mehta. He's the man behind the Vihasa program in India. He's the Dr. Ashok Mehta. There are 7 modules with the introductory module of the building resilience. The first module is on values, peace, positivity, compassion, cooperation, valuing yourself, and spirituality in healthcare. We have 7 spiritual tools while we do workshops with these modules. The first one is the meditation, visualization, reflection, creativity, appreciation, listening, and playfulness. Meditation, it quietens and focuses the mind. direct thoughts to a desired state of feeling, such as being peaceful, contented, silent in the mind. It makes us calm, light, and happy. Visualization. Visualization is using our mind to create positive images, draw on creativity and intuitions. Maybe in our past something must have gone wrong. So we can stop at that level and observe, and we can steer by visualizing proper picture. Remember things which have gone well, sight, sound, smells, touch, and atmosphere to be calm and peaceful. Reflection, learning from past experience, taking more detached view of the situation. It's called as SOS technique, stop, observe, and steer. Standing back and looking at self from outside, examine our own emotional reactions and feelings, move into a place of calm and peacefulness to observe what has happened. Listening, the active listening is more important. Maybe we must be spending few minutes, sometime maybe a minute, sometimes maybe a second. But that active listening makes that lot of difference, which we can call as a deep listening, which is having, the healing will take place. How we listen is more important. Listeners give full attention and the listening becomes a deeper, such as a listening is a spiritual tool. Here it is a total team is Dr. Ashok Mehta. Sir is a head and neck surgeon. It was in Tata Memorial Hospital when he was working earlier. The appreciation. In our team or in our department, appreciation usually makes a lot of role, but we try to avoid appreciate our colleagues or seniors or the juniors. The moment we tap them or we appreciate them, that will improve their own inner self-esteem and they will be more happy to work in a better way. People work better and more effectively when appreciated. It's one of the very effective tool in healthcare. Creativity. Being a doctors, we are all left cerebral, we are rational, we are logical and scientific. Right side of the brain, it is intuitive, poetic and the creative. Being left-sided, we are dominance is the left part of the brain, but we are supposed to use our right brain for creating art, that will make us a complete human being, working in groups towards a common goal. It's a very creative approach, explores the generating and sharing of ideas, especially in a team building. It helps. These are all the people who are doing the creative work when we conduct the workshops on Vihasa. The play. Play removes the barriers among the team members. The play may be a very simple game, but still it will remove the barriers. The play is useful actually for the team building. Fun and laughter essential to balance serious discussions and deep reflection. The quality of play open people's heart and bring groups together. Being playful is being spontaneous and carefree, letting go of barriers, lightness, having easy way with others. There are 3 key principles in this Vihasa. Physician heal thyself. First, the physician takes care about himself. He has to heal. Then learning through experience. Values are best understood and explored through direct experience. It is a facilitated experiential learning program. And then the learning experience is relevant to the participants and we are implementing at our work level. It's like an experiential learning. If we hear something, we forget. It's a human tendency. If we see something and sometimes we may remember, but if we do something, we can understand better. So when there is a time for reflection and sharing in a supportive environment, we learn in a better way. It was the same Vihasa program when it was conducted in China. The participants has done what is the difference between skill training and value training. If you see here, skill training is a content based, it is bombarded on our brain. Whereas this values training is process based, it is coming from the heart. It's like from inside outwards, whereas skill training is outside to inwards. There was a study which was published in the research article. It was in the year of 2019. The module of the positivity was used in nursing students. They found even the few sessions have helped them to improve their efficiency in work level. It revealed that the pre-interventional assessment, the majority of nursing students have average well-being in the experimental group and 50% in the control group. The study concluded that values in healthcare selected module positivity was effective in enhancing the well-being of the nursing students. And there was a poster presentation was presented on this Vihasa in G20 summit in New Delhi in April 23. The same thing. We conduct workshops in a group of 20 to 25 members. And we always give time for the participant to share. And we do the group activities. And they do a lot of creativity and they enjoy the session of doing all these creative works. And the people come with so many ideas during the participation. And this is a closure of the workshop, how we do. Thank you very much. One small change can have an enormous effect with us. Thank you.
Thank you, madam. So the real sense of spirituality in medical practice that is being exposed. Any questions?
Thank you, madam. That was excellent. We see young doctors coming through the medical curriculum now. I came out of one such 40 years ago. There's a great difference in the way we approached medicine and the way the new generation, who are far more clever than us, and their brains are connected differently compared to ours. They certainly are brighter kids coming through the network. But what I find is that, as was commented about previous question person today, up to third year, they seem to carry a lot of empathy within them, which is part of the base. And then suddenly they seem to lose it over time. But as doctors, me in the field for 40 years, it's less of a science. It's more of a mixture of science and humanities. The communication, the social interactions, be able to link and communicate with another person is a social science, and we are never taught that. I was just wondering how your Vihasa program might help young undergraduates and postgraduates, stop them from committing suicide, and get more job satisfaction from treating patients by incorporating all these tools that you have mentioned very early on in their curriculum to be holistic doctors and not just specialists in neurology or psychiatry or what have you. So what do you advise the NMC to do?
Sir, these are all the workshops which we conduct. Each and every module, there are 7 modules. At least the minimum 3 hours workshop is required. And sometimes we conduct throughout the day, like morning 10 to 5. Once they participate in the workshops, they will understand. They themselves will come for the solutions, what problem they are facing. They work on themselves. So with that solution, they try to implement. So once they start implement, there will be a lot of improvement in their personal and professional life both.
Maybe it will help to reach out to the UG colleges to offer your
Yes,
services.
sir. That's the reason. Actually, recently, few days back, in Andhra Pradesh, Director of Medical Education and Research, that Vice Chairman, Dr. Narasimhan, now he is signing an agreement, an MOU, stating that which will be implemented in 153 medical colleges of medical, paramedical, nursing, physiotherapy, dental, and all the colleges. So, which will improve the total system. Basically, once it starts improving, then we can see the change.
Very good news. Thank you, madam, for the talk.
Thank you, sir.
Thank you.
Thank you. Thank you.